Hey guys, it's Dr. Jackson from the Sports Pod. Now, today I'd like to talk a little bit about knee injuries, especially injuries to your meniscus. I'm going to basically lump this into my series of basketball related injuries. Now, on the hierarchy of injuries, sprain strains are number one, especially to the ankle. The second area most affected is going to be your hip, and then the third area, which is going to be affected, is generally speaking your knee. So today we're going to focus on the knee, in particular meniscus injuries. So let's kind of get into it, guys. I'm going to give you a brief outline of, how do you get an injury to your meniscus, the anatomy of the meniscus, how do you know if you have a meniscus, etc., etc. So let's get on into it. So let's start with anatomy. What is it? The meniscus or menisci are actually two structures in the knee. So they're C-shaped pieces of cartilage in the knee. You have one on the inside of your knee and outside of your knee. That would be your medial meniscus and your lateral meniscus. Now, generally speaking, the medial meniscus is usually the menisci which is injured most of the time. But having said that, it's not uncommon to have an injury to the lateral meniscus. It's just most oftentimes associated with the medial meniscus. Now, what does that meniscus do? Well, like I said, the meniscus is a fibrocartilage structure. It helps to actually dissipate load in the knee. It helps to absorb shock in the knee. It also helps to basically increase the surface area and basically even out the uneven contours of the knee. So, having said that, where in the knee is the meniscus? Well, it's actually between your femur and your tibia. So the femur is your thigh bone, the largest bone in your body, and then you have your shin bone, which is the tibia. Now, both of those structures have uneven surfaces that articulate with each other. So the menisci basically fit right in the middle of those two, even those out, and help disperse the load. So, how do you have, an injury to your meniscus? Well, first off, like I said, the meniscus is there to absorb shock. So, usually there's some sort of compression in the joint mixed with some sort of rotational component, and this causes damage to the knee. Now, sometimes you can have contact forces to the knee, and then that could cause you to have an injury. Oftentimes, though, if you have contact with the knee, other structures are going to be involved, such as your MCL, which is your medial collateral ligament, or maybe even your ACL or your PCL. But I don't want to really talk about those today. So, now that we've kind of talked a little bit about where is the meniscus, what is the meniscus, what does it do, how do you injure it, maybe you're thinking now, well, how do I know if I injured it? So what are some of the signs and symptoms associated with a meniscus injury? Not necessarily a tear, but just an injury to the meniscus in general. So usually you're going to have pain in that basically joint line area. So we call it joint line tenderness. So the area where the femur meets the tibia on either the inside or outside of the knee, if you palpate that and it's tender, that's usually, maybe not necessarily a red flag, but a warning sign that something more serious may be going on. Also, you're going to feel like your knee locks out, like it locks up on you. It's very painful. It doesn't want to release. You may feel like your knee is unstable. And oftentimes, if you do have any bruising or swelling, it's generally going to take like a few hours or maybe even a day or more to really fully come into effect, which is a little bit different, than if you have an injury to your ACL. And the reason it takes so long for kind of the swelling and bruising to accumulate is because depending on what area of the meniscus that's injured, there may not be a very good blood supply. So this brings up another little piece of anatomy that I want to go over, and that's the different areas of your meniscus. Now, you have a red zone and a white zone. So just basically think of red equals blood. If you have blood there, that means you have a good blood supply. So the red zone is more vascular in nature and heals a lot quicker, whereas the white zone does not have a good blood supply and takes a lot longer to actually heal. So that's pretty much it, guys. Hope you learned something from this video. If you have any questions, feel free to comment. You can reach me via social media down here in my left-hand corner. Once again, I'm Dr. Jackson from the Sports Pod, and move free.